Thank you, Jacqueline, and thank you all for coming out today and covering this important appeal for help. I'm going to cut to the chase. I'm going to be doing some asking, some requesting, some pleading, and some begging for blood donations. Right now, the safety net that is under our community that's provided by a reliable supply of blood is frayed. It's not giving the protection we need, and we need all types to respond to this request to rebuild that safety net. That's especially for O's, as was mentioned. We're having to import those, but also platelet donors and all other donors. Please come in and help us build back the security that we're accustomed to experiencing. How bad is it? Well, right now, I'm not sure OBI would be able to respond to a large mass casualty disaster event. And on a day when we've had tornadoes and damage, I think we can all realize that that's an immediate impact on a lot of people. We don't want to be in a position where we fail those potential victims by not having the blood for them, and we certainly don't want to fail those or let down those first responders and medical teams that want to rescue every possible survivor. That's the situation we're in now. We want to build that security back to deliver our mission to save as many people as possible through blood transfusion. Who's at risk? Well, if you think of an F5 tornado that might hit us someday or some other disaster, it's me, it's everybody in this room, it's everybody who's hearing or seeing this message, and then beyond that, it's all of the people we care about. It's our kids, it's our parents, it's our loved ones, it's our partners, it's our spouses, it's our grandparents, it's our grandchildren. It's our nephews, it's our nieces, it's our neighbors, it's our friends, and it's our coworkers. It's everybody's at risk at this point in a worst case scenario. Fortunately, people who are in the hospital today are not affected. We've got enough blood for now, but we don't have enough to be secure in worst case scenarios. And that's what we're here to do. Never have a doubt about the ability of blood to save lives. So we're asking for help getting back to the position we're accustomed to. And really, falling behind on blood is something relatively new for us. It's become almost a habit. I think this is the fourth year in a row was mentioned that we're asking after the holidays for help. We never used to be in this situation. Something has changed and we need help. We need to get back to that security and not ask other people for help. Other parts of the country right now are taking care of our loved ones. They are propping up our communities. And having been in Oklahoma for 2 decades now, I know my neighbors, I know my coworkers and friends are stronger than that. We are a strong, self-reliant, generous, giving community. And to ask the people of South Carolina, those are the folks who helped us most recently with blood, help us take care of our own is insulting to me. I know we're better than that. I know the Oklahoma standard is stronger than that. So getting back to self-reliance and the ability to help our own is easy for us. It's what we always do. We're just waving the flag and saying blood is part of that and we need your help now. So again, the risk of, how did we get here? It's a math problem. We don't have enough donors anymore. We're losing donors to aging out, the demographics. We have a lot of wonderful older donors. We need to replace them. An economist would say it's a supply and demand problem. As people age, they need more blood. That means we need to supply more blood. So there's supply and demand, there's a math problem with our donors, and actually one of the most troubling things for me is we're asking the same people over and over to give and support a larger and larger burden. They're carrying a lot on their shoulders or their inner arms in this case, and they're going to get burned out. We're already seeing it. We can't ask the same people to do more and more lifting. We need more people to come in and join this heroic cause, this generous cause, this spiritually uplifting cause to help other people in their worst moments, their moments of trauma, their moments of jeopardy for their lives, surgeries. That's where we're asking you to step up and be a part of the solution. So one of the people right here is Millie. She wasn't able to come. She's a spokesperson for us. Putting a human face to our problem is absolutely what this is about. You can hear me talk forever, but her face, her life, her future is so much more powerful. That's what we're asking you to engage with. We do not want to show up for Millie with this bag empty and no hope and no love and no way forward. This bag is useless. Filled with blood, it's life-saving, it's life-transforming, and it gives comfort to people, gives hope to people. This bag needs to be filled, and if you hear me speaking right now, I'm asking you to help fill it. So that's the preamble. Now I'll get to all that. If you didn't think that was the asking and begging part, I'll get to the actual asking, requesting, pleading, and begging. I'm going to ask our current donors, the folks who give with us regularly, to step up one more time. We urgently need you to fill the need by filling this bag or some other bag of blood to build back the safety net. We've done it before, we can do it again. Think of it as a last present, an actual life-changing gift of a lifetime to somebody who needs that extra boost to start the new year. It's brightness and hope given into a hospital room, an ER department, or a cancer clinic that you can come and shine that light on them. So please, if you've been a donor, come right back in and help us now. Also, as a request to our current donors, please help us recruit. We need more people making that one-on-one ask, people who know the story of blood, patients who've received blood, drive coordinators who already recruit. We need you to recruit more, volunteers who help us, blood donors who help us already. Bring more people to the party. Let's, many open arms make for lighter work. We need many more people driving this blood supply forward. So again, the ask is for blood, the request is to recruit somebody in. Make them part of what you know is an uplifting experience. I recently had a friend, 50 years old, never given before. She came in because she wanted to challenge herself to do something for her birthday to become a stronger and better human being. Uplift her life by taking on a new challenge, becoming a hero in an hour or less. So that's where this request is going out to. Please let's recruit more people in. Now the pleading is for the folks who are lapsed, those who haven't shown up for maybe 2024, 2025. We need you back. We miss you. We need you. You know how powerful it is already to give. You know you're able to do it. You know you're healthy enough to do it. You know that you've got the character and the strength to do it. We need you back. Remember, those Oreo cookies and those peanut nutter butters never taste better than when you're eating them as a newly reconfirmed hero. We want you to come back and be with our staff again. Be part of the brightness and light you see behind me. You know it's an uplift for yourself and your self-worth when you help somebody in need. Be part of that. Take another swig from that cup. We want you to fill your own cup by filling blood bags for others. And lastly, the begging part is if you've never donated, asking you to come and give it a try. If you want to make yourself into a hero in 1 hour or less, you want to have the psychic boost of doing something like my friend who gave for the first time, transforming yourself from a non-giver into a giver, a medical hero and a healer from somebody who probably doesn't do that unless you're in the medical profession. This is a pathway to instant elevation. You got a bad day? Come in, give blood, you'll have a good day because you've made a difference, and in your heart and soul, you'll know that you've impacted the lives of people who are the sickest, most needing right now of a lift. So again, if you want to build yourself up by building up others, we have a way to do it. And I'll close here by paraphrasing one of my heroes. I'm going to make sure I don't mangle this too badly. But Winston Churchill has been a role model for so many people in taking times of adversity and turning them into wins, big wins. So I will abuse his famous quote about the Battle of Britain and the RAF fighters who beat back the Germans at that time. And I'll say, never in the field of human medicine have so many had such great opportunity to help with so little time and effort. So this is the moment to step up, be a hero, make a difference, make your community stronger, and look around and say the Oklahoma standard lives with me, and it lived with me today when I saved a life. Thank you.
I'm Chelsea Gilbertson, and I'm the Chief Medical Officer at Integris Health Baptist Medical Center, and I'm also an emergency medicine physician. This morning when I pulled in the parking lot, I noticed that our Blood Institute utilizes a visual, very similar to a gas gauge, to reflect where we are with our supply of blood in the state of Oklahoma. And it's on empty. And just as there are risks to driving our cars on an empty tank of gas, there's significant risk to our community when our blood supply is reflected as on empty. Every day, my team and I see firsthand how critical a very reliable blood supply is to providing patient care. Blood supply matters. Whether it's a trauma case, a complex surgery, cancer care, or even childbirth, blood transfusions occur multiple times per day, and this makes it critical that we have an adequate supply of blood on hand to provide to these patients in need at that time. When blood inventory drops, just as our gas gauge is on E right now for blood, the hospitals feel that impact. O-negative blood is the universal blood type. It's the universal donor, and it's what we reach for in emergencies when we don't have time to determine the patient's blood type. But O-positive blood is also very impactful. Today, just as you've heard, we do have a call to action. I also want to thank our current blood donors, and I do want to really encourage those who may be considering donating for the first time. The blood we provide to our patients must come from someone. I ask, please consider being that someone. On behalf of the patients we serve, thank you for stepping up. I genuinely believe that together we can strengthen the blood safety net that protects our community. So I think it's a really good question, and I think we live in a world over the past several years where we've gotten used to maybe something being on back order or a specific component of something we need not being available, so we can't get that product. And with blood, there are really no true substitutions for blood. And so we can't say, okay, well, what are we gonna use as our substitution? What's our backup? There's really no substitution. And so I think that's the answer of this isn't like other shortages that you may hear of. We have to have the donors, which is why we're appealing today to say, please give.
All right, and next up we are going to hear from Christy Davis and her daughter Addison Church. Christy and Addison have been amazing spokespersons for us. Addison here is recently rang the bell at OU Health after going through her cancer treatments. We are grateful for you both to be here, and I know Addison, you're an O negative, and Christy, you're an O positive.
Yes.
And we would just love for you two to share a little bit of your story.
Perfect. Thank you so much. Hi, as she said, I'm Christy Davis, and this is Addison Church. In 2023, we had a normal life. She was playing like a little girl who was 10 years old, and we went to the doctor because she was passing out. Found out that she had T-cell ALL leukemia. Life stopped. She was down so much blood and platelets. She's had 36 bags of whole blood, and she's had 24 bags of platelets. Without you amazing donors, she wouldn't still be standing here. She was passing out. She was very, very sick. Her prognosis was very low because she did need so much blood, and her bone marrow is not producing like it needed to be. So thank you for being here and for donating. We found out shortly after Addison got diagnosed that she was O negative. That only makes up 7% of blood, which is really scary to me because there were times that we actually had to wait for blood. It's really scary sitting there not knowing if your kid can live because there's not blood for her. And I'm O positive. I had never donated in my life before. I thought that blood was just for traumas and emergencies, which is very, very important. But I never had it impact my life so much because I didn't grow up doing it. I will tell you now, I'm a very faithful donor. I love it. There's nothing better than being able to donate and seeing people donate and just selflessly give life. She wouldn't be here. So I beg and plead, like everyone else, please don't let someone be sitting there not knowing if their life is going to be able to go on, or not knowing if their child or grandma or grandpa or sister or brother or mom or dad or even anyone, neighbor, if they can live, because there's no blood for them. As she said as well, O negative is used in trauma situations, and 7%. She really, really needed it. 36 bags is a whole bunch of blood. And it's very scary when you don't know. You want to say something?
Well, first off, I'd like to say thank you to all the donors for giving all the blood. It's really appreciated for everyone that needs them. And I'd just like to say, every time when I first go to the hospital, the first time I got blood, it was really scary. I can admit that. It was scary because I never done it before. I have never liked blood ever, but I did it and I felt a lot better. Thanks to the blood donations, I am standing here right now talking to you all. If not, then I would be dead. So it's very helpful.
Thank you guys so much. We really appreciate you. Please keep donating. Please go in, tell someone. Everyone who has been a part of anything to do with, OBI or, getting those wonderful messages out, and anyone who has even just restocked cookies or waters to make sure that people could donate. Thank you. Thank you from the bottom of my heart for letting Addison have her dreams and live and be a little girl again. She gets to play, and there's nothing worse than not knowing if that's going to exist again. Thank you so much. It's amazing how you live a day-to-day life, just trying to survive and, still doing what you love. But when something can impact you so much that your whole life stops for a moment, you really have time to think and you have time to reflect. And that being said, I was sitting there in a hospital room with her watching all of these medical things go on. And I decided, between seeing her and all the other amazing little children who were so strong, they're little heroes in that unit, I decided that I needed to go back to school and I needed to get my RN license so that I could not only go do something that I absolutely love, but that I could also encourage people. And I knew exactly what to say in the moments when nothing needs to be said sometimes. I had so many wonderful nurses and so many doctors and so many other medical staff, volunteers. I can't even tell you how many people have been just there, and now they're family. And what better thing to do than work with people who are family for you? I just want everyone to know how important it is to keep going and keep fighting, keep donating. That's what we're here for. And the amount of love and support that we've had from everyone has just been the Oklahoma standard, as this doctor was talking about. So I decided to do that, and I did, and I graduated in December, actually. It's really exciting. And don't you think I will be talking about how important blood donation is?
I was very nervous.
I was very nervous, but everyone really inspired me, and I hope to be that inspiration to others as well.
I mean, from being afraid to donate blood to being a nurse, that's amazing.
I've always been an extremely hard stick, and I will tell you that there are no better people to stick you and get your blood on the first try than people at OBI. I have never, ever been able to give my blood anywhere else, at a doctor or a lab or anywhere else, on the first try. It usually takes about 5 or 6 tries. So I'm a horrible stick. And so I was terrified. I was like, why would I go do that and put myself through torture? However, every single time I have donated, very first try. So props to them because that is really good.
Addison, how did it feel seeing your mom walk past that stage? You must be really proud.
I am really proud. When I was watching her going down like this, what was it? The stage, going on the stage. She looked very happy, and I was really proud of her. She was just standing there, getting her badge, and feeling very proud, and I was very proud of her for her accomplishment. She studied for 2 years nonstop, having to work her 5 jobs, raising 3 kids, and clean the whole house, and all other things. So I give her props.
She screamed, "Go mom, go mom." I heard her.
Addison, how are you doing today?
I'm doing great. I've been playing with my little sister sometimes, running in the backyard, helping take out our dogs. Let's see here. I've also helped do laundry, all sorts of different things.
I know you're not old enough yet, but how important is it to you? Would you ever want to donate blood if you're able to at some point?
I would, 100%.
Addison likes to go into places where people are donating and thank the donors too. It's one of
I
our
do.
very favorite things to do. So she usually goes with me when I give blood so we can talk to everyone and thank them.
We appreciate you guys. Thank you so much.